Personally, when I think of cannabis, the first thing that comes to my mind is functionality. It allows me to focus a little bit better.
When I think of cannabis, I have confusion. I come from a different era. We were told that it was a dangerous drug. It was illegal. It was the wrong thing to do. Now it's certainly becoming a much more accepted activity for people. My name's Christine Bryan. I go by Chris. I'm from rural southeastern Michigan.
My name is David Polhamus, and I'm from the southern part of Michigan.
David has lived with us since he was 2 years old.
All my life, my grandmother, she was always the first person I would go to if I had a question. She was usually the one that was the expert. The main reasons I went for my medicinal card was because I knew that she would worry about me.
I graduated in 1965 and lived in the same rural area I live in now, and I really didn't know people who used cannabis. I had never used it myself. I had never intended to use cannabis, but I did accidentally about a month ago.
My grandmother calls me up and asks, would you guys like some cookies? I found that you still have some butter left over.
I mean, who knew marijuana came in butter form?
Bits of dough fall off, and so she decided to nibble on some of that.
Probably ate about 2/3 of a cookie. I felt fine, took him the cookies and went to work. And about a half an hour later, strange things happened to my body.
And I'm just like, oh no, Grandma's high.
Extremely dizzy, could barely stand. And I thought, why in the world would anyone do this to themselves? This is not a good feeling at all. I mean, I was scared. Could I overdose or something on marijuana? I'm not sure. I want to know, is my grandson going to be okay and making the right choices and the right decisions? I just want to be sure that we're doing the right thing and that he's doing the right thing.
Hi guys, I'm Dr. Lee. I specialize in certifying patients for medical marijuana. I'm here to answer any questions you might have about cannabis. What can I answer for you?
So David uses cannabis medically for depression, anxiety, post-traumatic stress. Why is cannabis a good option for him to be using?
I rely on the side effect profile. When I think about why I've gone into cannabis, that's one of the main things that I think about. Having the security that cannabis is rarely fatal and rarely causes a need to go to the ER, be admitted to the hospital, that's important as a prescriber. We can really feel confident that it's a relatively safe substance.
For someone to start out using marijuana, for example, my grandmother, her first experience was pretty much having a 100 milligram edible for her first time. What would be like a good way for someone to start off if they were curious?
How did your experience go?
Well, I did it accidentally, and I think it was even more than 100. And it was not a good experience at all. I can't imagine why anyone would do that to their body.
Well, I would say that everyone's had an experience like that. I definitely have. I think you might have noticed some over-intoxication, which is something that we do know is a risk of edible products, especially compared to the inhaled products. So you want to be confident of how much you're taking at first. So finding a product that's well labeled and starting at a low dose, like 100 for a new patient who's marijuana naive or who's never had marijuana before. That's way too much. I would never suggest that. So if you were going to try again, I would probably start somewhere at 10 milligrams. And if you want to play it more conservatively, even most gummies that you're going to get are going to be about 10 milligrams of THC. So you can cut it in half and start at 5. And that's advice that I give a lot of people too.
Speaking of edibles, if you buy it, already something, brownies or cookies or whatever already prepared, I mean, is there enough oversight in the process? How do they know they didn't use moldy stuff or?
Yeah, that's a really important question to ask too. Cannabis products that make their way into dispensaries have to be tested by a third-party laboratory, and this includes both cannabis and CBD. And I think that's really important, especially when you're considering treating a family member. You can have that extra level of safety knowing that it's been evaluated before it gets to a dispensary.
I've never quite understood it myself, but what does CBD stand for?
Cannabidiol. It is a exogenous, meaning it's from outside of the body. It is an exogenous cannabinoid that works on our endocannabinoid system. So I do recommend it pretty often for people who are looking to try something during the daytime or who don't like the head high. CBD is definitely a viable option.
Would THC or CBD or both be better for pain relief versus depression? Is there like a cannabis for an ailment, I guess?
I love that topic because it really does reflect where cannabis medicine is going. Like, we know that patients who suffered from depression or anxiety for a long time, sometimes THC or cannabis can be, negatively impacted with their recovery, whereas CBD does not have those same effects. So that type of counseling that we're becoming more sure of, it can be really beneficial for certain populations. I really do feel like cannabis is one of the best treatments for it.
Can a person become addicted to cannabis?
I would say yes, you can become addicted to cannabis. If you're not careful, you can become over-dependent on cannabis like you can with any substance, really. But at the same time, I also want to paint a bigger picture as well, in comparison to a lot of the other things that are out there, like alcohol and opiates. The negative effect of cannabis on the healthcare system, like my area of expertise, is a lot lower than these other substances. My own experience treating patients in the ER, I get a lot of patients that have overdosed off alcohol and opiates, and very rarely will someone make it through the doors with like a cannabis over-intoxication.
What are the best things about using cannabis? What's the most positive things that have come out of cannabis use over the years?
Great. I think the most positive thing is that people with really challenging medical conditions can find something that really works for them. Multiple sclerosis, Huntington's disease, hard-hitting neurological diseases that in the past have not had a lot of effective treatments. And nowadays with cannabis and cannabis-related treatments, we have things that are, that paint a rosy picture. If we keep at it and keep working on the science, we might be able to find something that works for these really challenging conditions.
So after talking with the doctor and having all the information and being told what everything is, do you think like your ideas of stereotypes or anything like that, like your typical idea of a stoner has changed?
Yes, I think so. Our society is changing, and I hope that I'm open-minded enough to grow and learn and change my views as well.
Yeah, I think this was a pretty fun experience. I think this was really good for us to do.
I think so, yes.
Mm-hmm. And hopefully next time you won't give me such a headache if I go off and buy stuff.
Well, at least I understand more.
Yeah, and that's the important thing.